Hello, my name is Tiffany Nguyen, and I am currently a third year, and I am in class of 2021. And today I wanted to discuss Target in terms of their health promotion program and what I'd like to suggest. And the goal is to suggest a WHP that would aid in the health promotion of Target's workplace. Within the workplace, many workers suffer from chronic diseases, hypertension, obesity, and abnormal cholesterol. By coming up with a WHP, I hope to change the workplace health promotion for the better. And this is an introduction to Target. So, Target is known as a corporation where shoppers come to get their daily necessities as well as go on shopping sprees. They quote themselves as great shopping, celebrating diversity and inclusion, community engagement, and ethics at work. And Target is a general merchandise retailer, and with over 1,800 stores, Target employs over 350,000 employees. Their products consist of many different items such as electronics, toys, groceries, jewelry, and clothes. Jobs at Target include cashier, janitor, retailer, guest advocate, sales, food service, and etc. And there are Targets across all 50 United States, and within the United States, the healthcare system consists of both public and private, profit and nonprofit insurers. With a population of nearly 330 million, the United States spends about 17% of their GDP on health. Women here have life expectancies of 81, and men have life expectancies of 76. And within the US, capitalism plays a big part in health. Mostly led by the belief that the government should not intervene, it is said that there is more room for development and technology. However, just like their hybrid healthcare system, culture is also mixed in different ways. While others value a healthy body, others are led by food, and obesity rates within the United States run rampant. Unhealthy food options and big food portions has led to many health risks such as chronic disease, hypertension, obesity, and abnormal cholesterol. And the first step in working towards my goal is understanding the company values and what must be worked on. In order to get straight to the point, I created a plan to call the company and email the CEO. After getting in contact with human resources and the CEO, hopefully new information would allow me to design an effective WHP program. Additionally, I plan to look through their online health information. And in my email to Brian Cornell, the CEO of Target, I wrote in my email, Dear Target, Press Target, my name is Tiffany Nguyen, and I am a student at UCI, and I want to learn more about your company and hope to have a better understanding for the health promotion within the workplace. If you do not mind, I have a few questions that I would love to get answers on. And these are the list of questions that I had chose, ranging from how much employees miss work and as to why, and how many employees they have. And I wanted to know whether they knew that a WHP can lead to increased productivity, and how many and different types of health benefits are provided for their own employees. Fortunately, I did get a reply, but also unfortunately, it was extremely generic. I was directed to their website, so in the end, I had to turn to their website for more additional information. And one thing that I know about public health programs is that it is important that they have the potential to greatly impact in productivity and employee morale, and they also impact healthcare costs. To be more specific, a more effective WHP within Target would mean healthier individuals, which in turn benefits Target as a corporation. And the reason that Target should invest in a WHP is because it stands to reap many benefits with healthy employees. By promoting the health of their employees, they can reduce future medical and health services. Additionally, an improved environment in the workplace leads to a significant increase of productivity, which brings the company up higher. Also, brand image can increase with better benefits for employees, which in turn entices more people to to apply at Target. As for the employee benefits, good health behaviors, stress levels, blood pressure, glucose, and cholesterol have shown to have lower absenteeism. With an improved psychological well-being, employees have a lot of personal benefits from an effective WHP. And this is where the question comes in how we design the WHP program. So the problem within the United States is that many WHP programs lack the promotion of healthy body weights. Due to cultural factors, the obesity epidemic is one of extreme concern. Thankfully, it has been possible to promote better blood pressure, cholesterol, and glucose. However, most WHP programs have proven to be ineffective to maintaining a healthy body weight, which has led to other diseases such as chronic disease, hypertension, and abnormal cholesterol. The United States currently has a food culture that consists of low vegetables, dairy, fruits, and oils. Nearly half of the United States exceeds the total grains, added sugar, sodium, saturated fats, and proteins recommended by the CDC. According to the CDC, obesity is prevalent in 40% of adults aged from 20 to 39 and 45% in adults aged from 40 to 59. The goal of the WHP program that I want to promote consists of prevention of weight gain as well as use of resources for weight loss. Target's Team Member Life Resources has done a great job in providing education resources, dental benefits, wellness discounts, and medical benefits. Unfortunately, their Team Member Life Resources is 100% confidential in terms of employees. One can only find general information on their website, and I could not find questions or feedbacks from their employees in terms of the Team Member Life Resources. And a health topic that I would love to bring up to an employee is that the obesity epidemic is a forefront concern. Obesity has resulted in many other risks, and in order to combat the concerning obesity epidemic and health concerns that come with them, I would hope to see them join in on the WHP program. The first step to an effective WHP program is active participation. In order to create incentives, education is key. The next step is providing resources ranging from healthy foods, items, beverages, and exercise equipment. Right now, Target leaves their employees to their own devices during break. However, a cafeteria or a gym membership available to their employees may provide the workplace with the right resources needed to combat the obesity epidemic. Both education and resources go hand in hand when fighting the obesity epidemic. And in order to ensure that the program is effective, overall reports should be made for willing employees. To start with, the progress of each employee should be kept tracked through reported BMIs and surveys among employees on the path to healthier living. So over the course of every 3 months, they should take a survey for future goals and their current perceived health risks. Simply reporting weight loss is not the answer. Target should evaluate how an employee's health or self-perceived health has improved or changed. And things to expect is improved BMIs, healthier mindsets, decreased reported health effects, improved productivity, and reduction of medical and healthcare cost. Since it is based on feedback and statistical numbers, it is best to use an outline of a graph to report to the HR department or the CEO. In my opinion, Target is one of the better corporations in terms of health and medical benefits, but they have many things that they need to improve on. Their employees do not know how to effectively use their resources, and little awareness is being put into the workplace with so many resources. Target employees still struggle with high obesity rates and chronic diseases, diabetes, and hypertension. As mentioned before, a healthier employee would mean increased productivity and better brand image. In my opinion, I think another recommendation that would be great is encouraging the reduction of alcohol intake and drug use. And these are the references that I had used in order to create my WHP program, as well as other information that I used to gather.